This video is for anyone getting cataract surgery, and you might be wondering, if I was an eye doctor, what cataract surgery would I get for myself? This video will tell you exactly what I would do if I was getting cataract surgery for myself, and things that I would recommend for you as well to consider before you jump ahead and get one of the most important surgeries of your life to see clearly. So, a few steps need to happen before you get cataract surgery. That's different for you than it might be for me. So there's 4 things I would get. 1, you need to know your prescription for your glasses today. 2, the doctor's got to measure how long your eyeball is front to back, called the axial length. That's again the front of the cornea to the back of the eye, called the retina. That is called the axial length. They need to know how long your eyes are in order to calculate the power for the intraocular lens that they're going to put inside your eyeball. The next thing is they're going to do a corneal topographer, should measure the shape of the cornea in front of the eye. Now those are just the clinical measurements they need. But really the 4th thing is the most important, and only you can tell them that. That is your lifestyle. So if you're someone that has really picky vision requirements, that you want the sharpest vision possible and you're okay wearing glasses afterwards, then they're going to probably tell you to get a monofocal lens. A monofocal lens means it's just one power in the lens for seeing things usually far away or up close. You pick one or the other, but it's just one power in the lens called a monofocal. That's what I would do. For instance, I would get a monofocal lens because I'm really picky in the vision. Now, if you're less picky and you really want freedom from glasses, you're okay seeing 5 to 10%, a little bit blurrier at the distance or up close. In order to get freedom from glasses, you're okay to forego a little bit of that, get a little more halos and glare at nighttime as well. Then you would get a multifocal lens. A multifocal lens has all the different powers in it for seeing things far and up close. They have it all into the same lens, but because it's a jack of all trades, it's a master of none. So these are things that you want to consider for yourself. Now, since I told you in this video, I'll tell you what I would do. I would pick the monofocal lens because I'm really picky about my vision. And if I had to wear a pair of glasses, so be it. For reading a book up close, for instance. Now, with that said, now that I know, for instance, I would get a monofocal lens. Now the cataract surgery day is upon me. There are a few other things to consider. For instance, some doctors will cut into the eyeball with a knife to make an opening in the cornea so they can insert the new lens. Okay, now that's usually done well and there's no problems. At the same time, if I were to have it done the most precise way possible, I would have a laser do it. The laser can be super precise. They usually cut a small little opening, 2 to 3 millimeters on the side of the cornea. It's smaller, more precise, in my opinion, than the traditional using knives way. And for that reason, I would get a laser to open the cornea. I would get a laser to help me break up the old cataract and to make, we call it the capsular rhexis. That would help to break up the cataract in order for me to insert the new lens. After they suck out the old lens, they insert the new lens. And I'll tell you exactly what lens I would pick. I would pick a light adjustable lens if I were to get cataract surgery. The beauty of the light adjustable lens is they put the lens into the eye, and then afterwards, as you're healing, they can find out if the prescription was dead on, and if it was a little bit off, they can actually adjust the lens after the implant's in the eye without having to go back in and do another surgery or replace the lens altogether. They can actually adjust the lens afterwards with special light treatment, even a week or 2 afterwards. And then they would do one final one after you're happy to lock it in place. And so again, if it was my eyes, I would do a monofocal lens, which is just the generic term for just one power lens. And the one I would pick would be a light adjustable lens. After getting the light adjustable lens, you're going to get a couple eye drops, usually one to prevent infection, one to prevent inflammation. And those eye drops are very crucial for you to heal properly so you have no complications after cataract surgery. So with that said, I hope this video was helpful. If it was my eyes, I would get a light adjustable monofocal lens. I'd wear reading glasses if I had to for up close. Now you can also get something called monovision, by the way. You can still get the monofocal lens with the light adjustable lens I mentioned, But you could have one eye see far, one eye see up close. And in my experience, those patients that opt for that, they actually do extremely well. They don't have to wear glasses for reading a book or driving a car. They can do all in one without having to worry about all the different rings of power in the lens, which might cause additional glare and halos. So that's might be the best of both worlds for a lot of the patients out there. But if you have very high demands for stereo vision, using both eyes together for seeing things up far away and up close, you might just get both eyes seeing far away and just having a pair of glasses to read things up close. Again, those are personal decisions. I'm just telling you what I would do. I would just get monofocal light adjustable lenses and wear reading glasses as needed. I hope this video was helpful for any of you guys. If you have any questions about your eyes, feel free to email us at social@insightvisionoc.com. We read every single email, and if you have any questions, leave them in the comments and we can also answer them as well. Hope this was good for you guys, and see you later on our next video talking about more about things you can do to make your eyes healthy for life.